So as well as understanding the treatment experience of the patients, you can really understand the outcomes, the assessments that you're using in the clinical trial. You can get the patient's experience of any changes that they've observed over the clinical trial, and you can really relate that to the measures that you're using, the quantitative data. It gives you a really rich source of qualitative data to explore the experience and get that full perspective of the changes that you're seeing in the endpoint, so you can really understand that change. And this could help in terms of validating an endpoint. It can also help for assessing and interpreting the change that you see in any measure, which on a questionnaire can be quite dry. It's a number, and what does that mean? And that's what exit interviews can actually help us with. Within the clinical trials, you use more traditional methods for evaluating meaningful change thresholds, such as anchor assessments, and you can use distribution-based methods to evaluate the data at the end to help you interpret and understand that change. But really having that extra bit, the qualitative, rich data from the patients, can help provide that context, and it can help you to get an additional anchor to use for evaluating and determining what is a meaningful change. But it can also help you to provide extra data and extra context that you can use to understand the change beyond whether it meets that threshold of whether it's meaningful or not.